Hi, you're back with Dr. Kelly Pearson, and this is part two of four parts around fat. And today we're going to talk about how fat plays a role in pain. As a chiropractic physician of over 30 years, this is incredibly important for helping my patients get to a place where they feel great. In the last session, we talked about polyunsaturated and saturated fats, and I want to talk just for a moment about polyunsaturated. We'll get to that chart again for review that we saw in the last session. When we're talking about omega-6 fats, we're talking about a fat where the sixth carbon from the left, because remember fats are defined as carbon chains, the sixth carbon from the left has a hydrogen attached. That's an omega-6. These types of oils and fats have the proclivity to increase inflammation. You think, now wait a second, why would I ever want to do that? Well, the truth of the matter is, you and I do want to be able to become inflamed when we're attacked by a virus or a bacteria. We want the white blood cells to come out. We want World War III, but then we want it to end. And omega-3s, on the other hand, we certainly have heard about those perhaps a little bit more. They're found in fish and some other things we'll review again, but their function is to reduce inflammation. Well, if we take a look at this original chart, reminding you of the monounsaturated fats, and there up at the top you see polyunsaturated 3s and polyunsaturated omega-6s, again reminding you that the 3s reduce inflammation and the 6s increase inflammation. There should be a balance in the body. But when we take a look at a normal ratio in our world to 3s to 6, from omega-3s to 6s, if we were to eat really well and eat balanced meals, that ratio at the end of the day should be about 4 to 1, omega-6s to 3s. But what's happening because of all this consumption of processed food companies like to make money, so they happen to use the cheapest oils possible, and those are typically the soy and the corn oils that they use in all their products. So at the end of the day, what happens when you and I consume processed foods, instead of a 4 to 1 ratio, that ratio becomes nutty at 50 to 1. And that is why we have such a huge proclivity to become inflamed and moreover stay inflamed. When I touch my patients and they hurt everywhere, I know that they, generally speaking, are processed food consumers, and they are not getting enough of the omega-3s to the omega-6s. And that's why it's so critical that I tell them, please take fish oil that makes sure does not contain mercury. If you're a vegetarian, let's get the flaxseed oil in, which is not as easily metabolized in the body, but nonetheless a good source of omega-3s. And to reduce your processed oils, that will automatically reduce your proclivity for inflammation in the body. Instead of becoming inflamed and having it go away, as we normally should do if we're exposed to an irritant, people with this ratio stay inflamed and they hurt everywhere, and their healing is potentially very slow. Here's an example of a young person after a knee surgery. Now, they had a lot of swelling after surgery, but this was over about 2 months. The knee is still swollen, and this little person has a horrible diet full of processed foods and Coke and pop and things of that nature. So it's critical to recognize that if you're having a slow recovery from an injury or slow recovery from a surgery, you need to take a look at your ratio of 6s to 3s, and that's why it is ever so important to recognize the importance of reducing processed foods and making sure we're getting more of those omega-3s that we discussed earlier. So on our next session, we're going to talk about how do we cook safely with oils, and what kinds of oils do we get to eat every day and should eat every day. So stay tuned to the next session, and I look forward to seeing you back.